So, first of all, I hope you see well the slides. Let me start with the migration landscape in Asia and the Pacific and touch upon overall statistics of migration in this region. Under the umbrella of migration, it captures both labor migration. This is the graph on the left, and migration and displacement due to conflicts that include refugees, asylum seekers, and I will come back to that. Oh, it's not so easy to use, but...
The blue, the green button.
That's one.
Okay.
Yeah, but sometimes the screen is a bit, yeah. So, I was mentioning the migration and displacement due to conflicts that include refugees, asylum seekers, and internally displaced persons. You see from the slide that it is remarkable that the Asia-Pacific region contributes to 30%, and you can see in the middle of the slide, the Asia-Pacific region contributes to 30% of global international migration stock, with around 82.6 people in the region who leave their host countries for work and other reasons. AP region also receives around 42.6 million international migrants, and the highest concentration, 10.6 million, is in South Asia. And again, you can see on the left side of the slide. Another important point relates to intra-regional migration, and more than 1/3, or 34.9 million out of the 82.6 million migrants, practice intra-regional migration and they move to another country within the region. As of mid-2022, on the right side of the slide, around 4.7 million refugees, about 800,000 asylum seekers, and 7.3 million IDPs in this region. So this second slide is really to provide the snapshot of volume of migrants in popular destination countries. I'm not going to read all, but you can see that in Thailand, you have approximately 3 million. This is about 4% of the total population. Malaysia, 2.5 million, about 7% of total population of 34.6 million. Japan, 2.56 million in terms of volume of migrants. Singapore, and finally Australia. So these are popular destination countries. In this slide, it's really to show the inequalities and vulnerabilities faced by migrants. And you can see that the lives of migrants are not easy in many aspects, and they face daunting inequalities and vulnerabilities. In this slide, I'm trying to categorize into three categories of inequalities and vulnerabilities faced by migrants. And you can see that you have stigma and discrimination, violence, and you can, on the left side of the slide, you can see one of the box where you can, that show the double or triple stigma burden of being a migrant, people living with HIV, and or key population. You also have all the issue around lack of or limited access to essential health services, including HIV and reproductive health. And you also have all the livelihood challenges which which create vulnerability, like poor living conditions. So why in the previous slide, we just talked about inequalities and vulnerabilities faced by migrants. These are the facts, but we have limited data on migrants. Why? And here you need to read the slide from the bottom to the top, and political sensitivities, coordination, and commitment challenges compounded by restricted laws and policies hampered the data collection, sharing, and utilization of migrant health data. This, in turn, has impact on evidence-based policy and advocacy efforts to improve migrants' health outcomes. Without data, voices of migrants haven't heard enough, issues of migrants are overlooked, not enough actions and interventions are taken to address inequalities. Why migrants are being left behind? You have top 4 reasons that are highlighted here of why migrants are being left behind. Number 1, it's restricted laws and policies. Second, limited access to health information and services. Third, vulnerability to exploitation. And 4th top reason, stigma and discrimination. In relation with the reason, one of the first top reason of why migrants are being left behind, we are showing this slide related to restricted laws and policies. And this is one of the examples of punitive laws on policies on entry, stay, and residence based on HIV status of migrants. I'm not going to detail all, but you can see in different sub-regions, Southeast Asia, Pacific, the countries where it's yes or no, and then South Asia, East Asia. This slide is based on the country response to UNAIDS Global AIDS monitoring report that is being conducted annually. And this is about the law and policies that enable documented migrants to access HIV services under the same conditions as citizens. In 11 countries, documented migrants, these are the countries under yes and in green. In 11 countries, documented migrants can access HIV services under the same conditions as citizens, which is commendable. You will notice that about 25 countries did not answer the question or no data is available, which is worrisome since no data does not equate to enabling policy. And as presented in one of the earlier slides, without data, it's really difficult to pursue policy and advocacy dialogues. This slide is now about undocumented migrants, and you will see that 5 countries in red explicitly answered that they don't have policy that undocumented migrants can access HIV services under the same condition as citizens. We can upload 10 countries that provide HIV services to undocumented migrants, but we still have 23 countries with no data. So, on this slide, what is the key message? The key message is that being migrant alone has a high potential to face discrimination, but migrant LGBTQI faces significant burden of stigma, discrimination, and harassment throughout the migration journey. And based on the study done by ILO and UN Women, you can see that 27 of migrant workers with diverse SOGI experience discrimination. And on the right side of the pie on the right side of the slide, you can see that they experience discrimination, violence, or harassment, and major perpetrators of this violence, discrimination, or harassment are police, 56%, you can see on the pie, and border officials, 20, contributing to this harassment for 20%. So when you are a migrant, you face myriad issues from economic hardships to violations of human rights and denial of access to services. I'm not going to read what is all in the bubbles, but they really illustrate the myriad of issues faced by migrants. Here, no need to read all the text. I know it's a busy slide, but it's really to show, to illustrate another example of multifaceted barriers faced by migrant workers in accessing HIV services. Some of them cannot access services due to undocumented status. Some are due to the nature of work, either constantly moving or working in far away plantations that make them inaccessible to services. Some cannot access services due to language barriers. This is also something important to keep in mind. But some migrants might have all these conditions, and some may have more than one conditions, which make the situation a bit complicated. So here, just to show that the main cause of migrants' deaths in Asia Pacific collected by International Organization for Migration, Missing Migrant Project Database. And it's very sad to see the causes of death, such as accident, drowning, lack of access of healthcare, violence, etc. This is very clear that significant majority of deaths are preventable and avoidable if policies would have been favorable, if there were no stigma, no discrimination, exploitation, and inequalities, if we could promise safe, orderly, and dignified migration for all migrants. It is also noteworthy that about a quarter, and this is the number in red, 23%, about a quarter of migrant deaths are due to sickness and lack of access to adequate health care, including, HIV and AIDS. Now, just have a look at the epidemiologic data. Bottom line is that migrants have 3 to 4 times higher HIV prevalence as compared to the general population. Migration alone is not a risk factor for HIV, but vulnerabilities and intersectionality associated with being migrants and migrant processes place migrants at higher risk of HIV infection. And I think it's really important to say that right away. So it's about the inequalities in HIV service provision undermining the migrants' right to health. We all know that Thailand is one of the countries who open arms for documented migrants with provision of healthcare, but even in Thailand, there is stark contrast in access to HIV treatment services. And you can see from the left side of the slide, Thailand is well known for its success on treatment coverage and for all Thai people. 90%, you can see from the chart there, 90% of people living with HIV know their status. 90% of them are on treatment, and among those on treatment, 97% are virally suppressed. And we know how successful this country is doing. And on the right side of the slide, you can see that for migrants, only 72% of people living with HIV who know the status are on treatment as compared to 90% for Thai citizens. And we don't have data on viral suppression, neither the estimated migrant living with HIV. We don't have data. So you see that consistently, this issue around lack of data is coming up. And as I mentioned before, no data is not a good sign for migrant programs in general, and no data can lead to no action. So the title of the presentation as requested by the organizer is Inequality and HIV Response in Asia Pacific. And this is time for me to connect you with the Global AIDS Strategy 2021-2026 that you all know, that aims to end inequalities and putting people at the center. It has 3 pillars or 3 strategic priorities. And you can see on the right side of the slide, highlighted in yellow, strategic priority 3, which focuses on integration of HIV into systems for health and social protection, humanitarian setting, and pandemic. This slide is just to remind us the snapshot of the targets of ending inequalities of the previous slide where I showed the Global AIDS Strategy. And one of the core targets is that 90% of people living with HIV and people at risk, and that includes migrants, are linked to people-centered and context-specific integrated services. This slide is just to unpack further on these targets. I'm not going to detail them, but you can see that there is, in terms of investments, by 2025, we would need $29 billion if we want to address this issue. We also have the 95 targets for people within the humanitarian setting who are at risk of HIV, and for the work around combination prevention options, you know. So these are the target, and you see also that integration of services, TB, hepatitis, and HIV services is also something important, and of course, it's also key to address gender-based violence among this group. Now, the way forward. On the left side of the slide, just reminding you what I touched upon before. So I touched upon the migration statistics and how significant the volume is in global scale. I showed evidence and examples on inequalities faced by migrants, how punitive laws and policies impact quality of life of migrants, and how it hampers migrants' access to services. I also remind you the Global AIDS Strategy and targets that aim to address inequalities. So with this last slide, it's really time to talk about solutions or how to equalize inequalities from the perspective of HIV response. However, having said that, as I said before, HIV is not a standalone issue, and neither is the migration. That's why, on that slide, I put in parallel how to equalize and the dimensions of good governance on migration as way forward, and this needs to go hand in hand. You cannot do only one part of the 3 blocks, building blocks that are showed on the slide. For instance, if you look at the right side of the slide, under the dimensions of good governance on migration, you will see that there is the third point around mobility dimension of crisis. This relates to preparedness of countries when they are faced with mobility dimensions of crisis linked to either disasters, the environment, and or conflict. The processes should be in place for nationals and not nationals, both during and after disasters, including whether humanitarian assistance is equally available to migrants as it is to citizens. So this is it. Thank you.
you.